Thank you to everyone who is sharing a land acknowledgement. I'm going to encourage you at any time during this webinar to go ahead and do so in the chat function. With that, we'd like to get started. The team at Arthritis Consumer Experts, or ACE for short, again, is going to welcome everyone to this second webinar in our two-part series titled Truth and Reconciliation, Health-Specific Calls to Action 18 to 24 and the Arthritis Community. My name is Ellen, and I'm incredibly grateful to be on this journey with you. Please allow me to serve as your moderator for today. This webinar will consist of a 40-minute presentation followed by a 15-minute Q&A period. Before we begin, I do have a few housekeeping items to mention. First, all participants are muted and cameras are off. Feel free to move around and stretch as you see fit. The content in the session will include topics that some may find triggering. Please give yourself the space to step away from your screen and reconnect when you're ready. Please use the chat box to post comments and the question box for questions during the webinar. Finally, if you experience any technical issues, please use the link provided on screen. To begin, I'd like to honor the land on which we gather. Arthritis Consumer Experts and its team members are incredibly grateful for the traditional, ancestral, and unceded territory of the Coast Salish peoples, namely the Musqueam, the Squamish, and the Tsleil-Waututh nations. We are thankful for the keepers of this land. And while we may gather on a virtual platform, we're going to encourage everyone to acknowledge the land from which you joined this call. Gamotan is the inspiration and visual moral center of the work we are doing at ACE. Gamotan means cleansing as healing. This artwork in the top left-hand corner was commissioned from Indigenous artist Courtney Alexandra Fox from the blood tribe of the Blackfoot Confederacy. Courtney is a woman, a mother, a daughter, a sister, a partner, and a friend. She creatively expresses emotions, thoughts, and connections through various mediums of art. I invite everyone to read this rich description of all the art represents, which will also be provided in a follow-up email. Please join me in welcoming Cheryl Cohen, President of Arthritis Consumer Experts and co-leader of the work we are doing towards truth and reconciliation. Welcome, Cheryl.
Thank you so much, Ellen, and hello to everyone out there in Virtual City, as we like to call it. It is an incredible honor for me, not only to be working closely with Dr. Fox and our whole team on the activities we're undertaking for truth and reconciliation and walking the path in a respectful, hopefully meaningful and progressive way. Dr. Terri-Lynn Fox is an esteemed scholar. She is an Indigenous woman from the Blood tribe within the Blackfoot Confederacy and practices her Siksikaitsitapi ways. We have learned so much already from Dr. Fox over this past year and a half, and we so look forward to that journey continuing. Her dissertation topic was on Indian residential schools. There will be another talk following this later or early June. She's going to speak to us obviously directly about the health-related calls to action 18 to 24. I could say about 2 hours more about Dr. Fox and the great expertise that she brings to this circle today. And Dr. Fox, we cannot be more grateful to you for helping us on this journey. I will turn it over to you.
Okay, good morning, everyone. Nistilkok Abik Modaki. That is my traditional Blackfoot name. I was gifted that name when I was 2 years old by my grandfather. I come from the Blackfoot Confederacy. I also share the knowledge that I have gathered through the stories, the the teachings and the vision of our ancestors and the old ones, as well as speaking respectfully for future generations to come. So I come to you today to share specific calls to action and to create further dialogue as we learn together, as we grow together, as we dismantle the systems that have been unfair for Indigenous peoples for some time. So we will get right into the presentation. I must say that Arthritis Consumer Experts has been a wonderful organization to work with. I'm very honored and privileged to work alongside some genuine change agents as we move forward together towards truth and reconciliation. As we begin this dialogue, I want to open up your hearts and minds in a very gentle and respectful way. And as we move forward, reflect on your own insight, where your knowledge has come from, your perspectives, your thoughts, and your feelings. They are valuable, yet sometimes what we don't know, we don't know. And so when new information comes to us, it may create a dichotomy, this cognitive dissonance, if you will. But that's also a part of learning about others' perspectives, others' ways of knowing and being. So who am I? I often ask myself that. And I share that in a good way because I am part of everything around me. The ancestral teachings, the spiritual energy. I am a part of the language that Blackfoot people speak. Where have I come from? I've come from a rich background, yet that was enmeshed with colonial and oppressive policies for some time. My responsibility now, as I have grown, healed, gained knowledge from my worldview as well as non-Blackfoot worldviews, it's my responsibility to share what I know, but also create change when and where possible. And that's where I'm going, in a good way, together with those who want to walk the walk with us, with me, as we move forward. Again, as we walk along this path together, maybe ask yourself, in the realm of systemic reconciliation posed within this presentation, where do I fit? Where am I situated at? How do I move forward? Is there some self-reflection and self-growth that I need to do? Where is my organization I work for? Where are they situated within this framework? What can I do and the organization to work alongside Indigenous peoples within Canadian state and the systems that we operate in? And how can I further lobby and advocate? What can the organization do that I'm a part of? How can we create meaningful partnerships and relationships and dismantle and help decrease the ever devastating statistics that we hear about that affect First Nations people? This is the framework that I use. I developed this framework within my dissertation as I began to truly understand myself within my own worldview, context, language, culture, and ancient ways of knowing and being, and provided this framework that others may also utilize as they move forward. As my dissertation was quite unique, and I'm probably not the only one, but however, in Blackfoot territory, I'm an Indigenous scholar. I had an all Indigenous committee I developed Indigenous methodologies, and all of the stories have come from Blackfoot people. So isn't that something to celebrate, right? When far too often, for too long, Indigenous people were put at the, in the back, and others talked about who we are and our history. Now we're creating that spiritual and collective consciousness about respect and understanding what others' worldviews are and how we can learn and grow together, because we share the land we walk upon. We share the land. We don't own it. We borrow it, and we ensure that it's intact for future generations. Now, the Truth and Reconciliation calls to action, as you know, there's 94. And specifically working within the health sector, what can we as change agents, as like-minded individuals, how can we impact the health calls to action 18 to 24? In 2015, the Truth and Reconciliation Commission released 6 volumes. That's a lot of reading to do. How far have we come within these published documents that were government funded? They're not supposed to sit on the shelves and collect dust, as many have. And what can we do as individuals, not only as health professionals, but also as individuals that have relationships, that have friendships across the land? How can we create that awareness? How can we desire to want to do better, to be better in a respectful way alongside others? Now, I've often used calls to action number 18 in so many presentations and meetings, reports, and documents that I have written. And it's somewhat of this eye-opener foundation for many to move forward with. And it details, we call upon the federal, provincial, territorial, and Aboriginal governments to acknowledge that the current state of Aboriginal health in Canada is a direct result of previous Canadian government policies, including residential schools, and to recognize and implement healthcare rights of Aboriginal people as identified in international law, constitutional law, and under the treaties. Given that many did not know what an Indian residential school was. Just recently, when I taught at Mount Royal University, some of the adult students did not know. So it's a quick refresher. So we must pressure and lobby governments of all levels to ensure that we include Indigenous history from the Indigenous lens and teach as young as we can, so that adult students entering academic institutions are familiar, and we have this infusion of knowledges being taught at academic institutions. We also have the United Nations Declaration on Indigenous People, where there's 46 articles where it details the rights of Aboriginal people, because they predate any policy that is imposed upon them, because they predate everything. We must understand and learn about these articles so that governments can address what hasn't been addressed, and we can then share the knowledge as we move forward. And under the treaties, we must ensure that we all know what the treaties are about, because we are all part of it. We all live in someone's ancient territory. We want to respect that as we move forward. Call to action number 19. We call upon the federal government in consultation with Aboriginal peoples to establish measurable goals to identify and close the gaps in health outcomes between Aboriginal and non-Aboriginal communities, and to publish an annual progress report. Such efforts would focus on indicators such as infant mortality, maternal health, suicide, mental health, addictions, life expectancy, birth rates, and so on. Here we look at chronic disease, we look at illness and injury, we look at mental health. All of these are enmeshed within trauma and many of the experiences that over the generations have unresolved trauma. Therefore, each succeeding generation ultimately inherits that without knowing. We must understand that spiritual realm of the energies of trauma. When we can do that, we can create and open up that many more pathways to health, to healing, to Indigenous health and ways of knowing and being within the context of leading a good life. Call to action number 20. In order to address the jurisdictional disputes who do not reside on reserves, we call upon the federal government to recognize, respect, and address the distinct health needs of Métis, Inuit, and off-reserve Aboriginal populations. So this is a huge issue. And I'm going to be bold here and say it's also a part of continuing assimilation tactics. I don't know how one can say, well, you don't live on reserve, therefore you don't qualify for services that are intended for people on reserve. Isn't that a continuance of hindering, limiting, and controlling First Nations people on reserve? It is. And I've felt the wrath of government policy as a student when I had to live off reserve and write letters. And most times I've learned by experience, where there is a way, there is a will. And I've always found a way. It wasn't without, tears and stress, but that desire, whatever it was, ancestral voices saying, don't give up, keep working hard, you will find your way. But we don't have to. Why should we feel stress all the time? Why should we suffer? That's not what Creator intended for anyone. Humanistic approaches ought to know that we are here. We are connected through so much more than what we see in every day. The spiritual connection is powerful. And we ought to remember that we're all connected. Call to action number 21. We call upon the federal government to provide sustainable funding for so many things, for everything. Right now, as it is, many people have to write proposals for increased funding, for continued funding, where, as we saw in one of the earlier calls to action, that the health rights, the treaty rights are entrenched in international law, constitutional law, and under the treaties. So it's this real dichotomy. You're saying one thing, but you want this. So government cannot be hypocritical anymore. We must ensure funding in all realms to ensure the health and well-being of Indigenous people becomes up to par with all Canadian people. This means the physical, mental, emotional, and spiritual health will be met There was many harms caused within residential schools. One element that we all too often forget is the spiritual element of all peoples. And this was hindered by outlawing, by punishing young Indigenous children, young First Nations children, when they spoke their language, when they were lonesome for their parents, when all they wanted was hugs to reassure them that they were safe. They received none of this. Call to action. Number 22. We call upon those who can affect change within the Canadian health system to recognize the value of Aboriginal healing practices and to use them in the treatment of Aboriginal patients in collaboration with Aboriginal healers and elders requested by Aboriginal patients. This is one element where I've assisted in other research projects to create that awareness within arthritis communities in urban settings, and to create this dialogue and checklist of who's who can I call, who can I invite to sit with me, to advocate for me, to pray with me, to introduce ancient healing practices from within Aboriginal cultures. And so this is a call upon to all of you to know this, to advocate, to lobby for your partners, for your clients, for your patients, for good relationships to occur, and for the enmeshing of Western models of healing with ancient Aboriginal methods of healing as well. So there's more work to do, but we're recognizing that we want to do it. We desire to create those relationships. Call to action number 23. We call upon all levels of government to increase the number of Aboriginal professionals working in the healthcare field, ensure the retention of Aboriginal healthcare providers in Aboriginal communities, and provide cultural competency training for all healthcare professionals. And here we are talking about the calls to action, talking about truth and reconciliation, talking about the history of Indigenous people, specifically from my perspective as a First Nations Siksikaitsitapi woman, and bringing forward that history, that knowledge, those events, those ways of knowing and being, as I share with you. So this would include that sustained and increased funding for Indigenous people to ensure that retention is looked upon, and there are strategies to keep Indigenous people within their communities. We ought not to keep fighting for increased salaries and wages. There should be this level right across the board where in First Nations communities, we're thinking, you know, I'm isolated, I'm away from a big city, and lack of housing on reserve, you know, all of these oppressive, you know, barriers, limitations. And so all of this needs to be reviewed, revised, and implemented so that it's fair and just within this specific realm of health and healing. Call to action number 24. We call upon the medical and nursing schools in Canada to require all students to take a course dealing with Aboriginal health issues, including the history and legacy of residential schools. The United Nations Declaration on the Rights of Indigenous People, treaties, and Aboriginal rights, included with Indigenous teachings and practices. This will require skills-based training in intercultural competency conflict resolution, human rights, and anti-racism. And I have seen some call for proposals being sent out, looking, send in your proposal for anti-racism, human rights, conflict resolution, critical incidents, cross-cultural trainings. And again, I myself, working on my reserve, I do the best I can. It gets overwhelming at times. And I think creating those partnerships, allowing room for people to say, how can I help? What can I do to ensure that these proposals are being sent in and we're acquiring and being selected for these funding dollars to create this awareness within this specific call to action. So again, looking at the UN declaration, the history and legacy of residential schools, these items will not go away. They will be forever entrenched in our history books, in our health books, in our looking at policy and change, looking at human rights. So these are very important calls to action that we are moving forward together. And I'm so honored to be a part of this. I want to mention also the call to action number 57 and 58, where it talks about professional development for public servants. So we call upon the federal, provincial, territorial, municipal governments to provide education to public servants in the history of Aboriginal people, including, again, the history and legacy of Indian residential schools, the UNDRIP, right? Aboriginal rights, Indigenous law, Aboriginal Crown relations. This requires a skill-based training, again, in intercultural competency. So we're not gonna see this disappear again. This is going to be at the forefront. This also, as I was reading this and rereading this, it's almost like non-Indigenous people need a degree on Indigenous people. If I turn the picture, which in sociology we often do, we look at perspectives, we frame things differently, we ask questions differently, who's asking the question and who's answering, all these perspectives. I have a degree in psychology. Most of it was on Western thought and theory. I have a degree in sociology. Most of it was in Western thought and theory, albeit my thesis was about intergenerational communication in Aboriginal life. Entering a PhD program, most of the content was non-Indigenous, but it was a couple of my courses were taught by Indigenous people, First Nations people. Now I'm so grateful that I listened to the ancestral voices so that I could complete a PhD dissertation on who I am, on the history, utilizing Blackfoot stories, albeit survivor stories. That's where the real teaching is. And say that I have, 3 degrees, how wonderful that is, how amazing that is. And I had to heal and walk forward and all blood, sweat, and tears, throughout my lifetime. Now I pose this, and maybe it's a call to action, that non-Indigenous people need a degree on all what we're talking about, right? We need to create that pressure where we're going to see real change, meaningful change, individual change, organizational change, right? Do we want Canada to look better? where the rates of the status of First Nations people on reserve isn't so low. We don't want it to be so low. We want the quality of life to be high, where Canada truly is a great place to live, based on dismantling the old thought, right? Creating new visions as we move forward, right? I have children and grandchildren that I want to ensure that it looks better, it looks equal, that they don't have to struggle. There's no need to struggle. Why should I suffer? I shouldn't suffer. I'm from this land. I'm not an immigrant. This is where I come from. I should feel pride. And creating those different ways of thinking and posing questions and answering them, we have to challenge what we already know to then say, I've learned something new. I'm also adding church apologies and reconciliation here. We call upon the Pope to issue an apology to survivors, their families, and communities from the Roman Catholic churches, due to the Roman Catholic Church's role in the spiritual, cultural, emotional, physical, and sexual abuse of First Nations, Inuit, and Métis children in Catholic-run residential schools, right? We call for the apology to be similar to the 2010 apology issued to Irish victims of abuse. So, last month, the Pope provided the apology on behalf of the Roman Catholic Church. And I actually listened to it again. I listened to the 2008 apology from the then Prime Minister Stephen Harper. And I sat there and I thought, I've gone through all this, you know, I wrote a dissertation, I'm feeling pretty good, and I still cried. I still cried. His apology, though, there was a huge Indigenous delegation that traveled to the Pope's home, the Vatican. And there was Indigenous dancing and prayers, and there was young people and older people, elders, spiritual leaders. And that felt pretty good. Albeit it's 2022, we have to desire and hope and dream big, so that when the dreams do come true, it's a reality. And I think for many, it was heartfelt. Many are passed away, and on a spiritual level, they probably felt it. But we're pushing forward through these areas where discomfort had occurred, and we're realizing, whoa, that wasn't so hard. Let's do it again. What else can we do? What else can we work through together? So I just received an announcement this morning that the Pope's visit will be the last week in July here to Canada. He'll visit Quebec, and he'll come to Edmonton, and he'll go on to Iqaluit. So yes, we're going to be a part of it. My team is going to be a part of it. If I have my way, I will be there, and we will create healing. Gamotan. We're going to survive. We're going to overcome, but we're going to do it together. That's the key word here. Together, not alone, not separately. We're going to come together, forge our spiritual energies, and create a good path moving forward. The Siksikaitsitapi methodology and systemic reconciliation, right? I'm just going to briefly read this. As a sociologist and a First Nations researcher, I posit this, that if we, here in the circle of intentional and respectful listening and dialogue, if we lead the way towards collective reconciliation, which includes increased understanding intertwined with a renewed sense of compassion and empathy, we truly are the change agents, the way forward. Our knowledge systems are vibrant, a kaleidoscope of realities the ethnosphere, and the wonder and awe of who we are, the animate and inanimate beings, the languages, the songs, the dances, the stories, the rituals, everything within that spectrum. If we could glean the abundance and strive for all to experience and know this, we are magnetically coming closer to intergenerational resilience and reconciliation for all. We're walking closer to systemic and intergenerational reconciliation. That's Gamotan. Has the process been meaningful? Do you think real change has or is occurring? From a document that I was reviewing and aligning it to our presentation and dialogue today, the report from, what's their name, Jewel and Mosby, informed that Canada has completed 3 of TRC's 94 calls to action in 2021. This brings the total to 11 completed calls to action since its release in 2015. That's fewer than 2 a year. Something to ponder about, something to think about, reread what the calls to action are. Where do I fit in individually, you know, within my organization, my family, community? How can I create that change that we so need to walk together in harmony? So they also talked about, they also posed these couple items. Not, excuse me, not every call to action requires Canada and Canadians to make the kinds of lasting, permanent, and structural changes that are needed to transform the relationship substantively. Some calls to action are symbolic, while others are structural, right? So just think about that. What am I doing? What can I do? And what is the responsibility of Canada as a whole, as a government? Completing the calls to action is being treated as a kind of tallying, right? This is from their perspective. It's like, are we checking it off and say it's completed, move on? You know, we've done this, everything should be all, you know, hunky-dory now. So they're kind of looking at it as 1, 2, 3, 4, 5, 94, we're all done. Yet you have to ask from the perspective of Indigenous people themselves and what they're doing to heal, to do the redress themselves from the wrongdoings that they have experienced. So again, reframing, looking at it from the other, not just mine, but the other, right? So questions will be framed differently. Answers will be different. And who's doing the action part? Who's creating that change? That's where we will see that real enmeshing of cultures moving towards truth and reconciliation. And I think I might be ahead of time here. May Creator guide you on your journey, and may we continue to walk together towards reconciliatory change, healing, and manifesting all the goodness that we all have to offer for future generations to come. Thank you.
Thank you, Dr. Fox, for, you know, such a moving and, you know, a way that you've explained the calls to action. I just, as Mary Westby now has just said, so powerful for me. So I've never had that interpretation, and the way you've breaking it down so that I can understand, you know, truly and truly grasp what this means, because when you read it at a surface level, it's words on a piece of paper, you don't truly understand the context. So now I feel like I have so much more knowledge. So thank you for sharing with us.
Thank you so much. It's an honor. It truly is an honor.
And I want to now switch to kind of the question and answer period. I know many people have already started engaging in, so there's a bunch of questions for you, Dr. Fox, but I just want to share this quote that you've shared with us kindly that I absolutely love. Cheryl is a big fan of as well. And it says, just where you are, that's the place to start. So as we kind of sit in the arthritis circle and we allow ourselves to reflect on what you've just said, and having this ground us even just a little bit more, okay, that's where to start, is right here, right now. Because as mentioned previously, we know that the work begins from within, and these are some of the questions that you've shared with us, some guiding questions, and I think it's incredibly important for us to say, yes, we acknowledge that, as you said, a lot of the calls to action are structural, right? They target organizations, institutions, government, but even with that, you have to think to yourself, what is my role on the path towards truth and reconciliation, and what myself, my own community, what can we rally to do to take that step forward? So with everything in mind, I'm going to encourage everyone to engage using the chat function if you have any comments, the Q&A function for questions and answers. And I will try to go kind of in the order that they were sent. If there are questions that we don't end up addressing today, please expect an email correspondence. All right, so the first one, and one of the individuals on the call has said, they experience RA, their grandfather also had an autoimmune condition as well. Dr. Terri-Lynn Fox, from your knowledge of the literature, this individual is Indigenous, mom was Indigenous. Are autoimmune conditions more prevalent in Indigenous peoples?
I'm going to say they are quite prevalent alongside diabetes. These are two stress-related chronic illnesses that, from the literature, depending on the literature that you like to use. So I've read Dr. Gabor Mate. If you look at his literature as a medical doctor and a world-renowned speaker relating to trauma and what that looks like. In my healing over the last 5-6 years, I have really begun to intimately know myself. And I must say, other than having rheumatoid arthritis, I have no other health issues. I'm going to also openly say, as a kid, I could take up any sport and I was very good. I was excellent. So how could I, as a healthy kid, start feeling symptoms at age 18 and then being diagnosed at age 22? And I'm going to openly share this. I'm only 50. So over half my life, I've been affected. Within the last 5 years, I've learned that it is stress related. So I grew up with 2 survivors of residential school. I attended a day school. Being affected by alcohol, by a workaholic, by, sometimes my parents didn't always know the best way to handle situations because they were taken. They were going through their own trauma at so many levels. How could they then be so aware of the needs of their children, especially when you had an awesome athlete, which I'm that. I knew I was that. So that I internalized the unresolved trauma, the unresolved issues my parents had. And so all of that, I was an athlete. I was perfectionist. I had to get straight A's. I have 4 children and I had to put them into everything I could do and could afford. I achieved 3 degrees many of those years as a single parent. How could I do all that stuff? But I have arthritis. So I knew when I left an abusive relationship that I had to figure out what on earth was going on, what's happening. And since then, I'm gonna say I haven't felt better since recognizing my own trauma. So if we begin to understand the family context, the intergenerational context, the historical context of these health issues, we can then begin to help professionals and the systems and funding for First Nations health services and education services and social services and recreational services to be all that they can be. We have some amazing athletes. They should be in college and university sports. They should be playing in the NBA, the NHL, the MBA and so forth. But because of the strain of spiritual trauma, of the mental health and emotional unresolved trauma, how do they know? How can they go and just run and say, I'm doing this and I'm coming back and I'm gonna help my community and I'm gonna be all that I can be? So much of what I know personally and professionally is that these unresolved grief trauma is so crucial to pushing through that pain and anguish, and it's going to sit in your system because the only way to get it out is through spiritual cleansing, is through their own First Nations ways of knowing and being, and for others to understand where they're at on their journey. If we are health professionals, that's our ethic. That is our obligation and our responsibility to understand that person wholeheartedly from from birth to where they're at when they come in with chronic illnesses, that at times it's too late to reverse the symptoms. But let's get at it now, where there's so many that we can help. That's my answer for that.
Thank you, Dr. Fox, and for sharing something so personal. And I think you bring up a great point. It's not, we read statistics on a piece of paper and we understand that this is more likely to occur in X than in Y, but you gave the background to it. You were able to, it's not that simple. And there are so many things that we need to at this very moment work on. So thank you. And I think a great question right on kind of this note is, do you have any specific examples of how to write traditional healing practices into a patient's plan of care? Or maybe the question is, how do we as healthcare professionals respectfully ask our Indigenous patients if they would like to include traditional practices into their care? So how do we start that dialogue?
I think speaking from a professional perspective where I work in a mental health and addictions agency, we include some of these questions right on the intake. So when they first come in, whether they're mandated or it's a self-referral, it's included, would you like to see an elder, right? What do you know of healing practices, and would you like us to support you through that? There's also a traditional healing fund that we have on reserve, and that if any client, any member wishes to utilize an elder, a knowledge keeper, a spiritual person, to, if they need tobacco, if they need an offering, if they need to provide food for a ceremony, this service is provided on my reserve. And I think there are many reserves that can utilize this service, but don't just ask the question. Start asking the question. The answer might be odd and awkward at first because it's never been asked, right? We have to be able to say it's okay if it's awkward and odd and we feel a little bit funny, but the more we ask a question, the more open patients, clients are to receiving that and saying, yes, I need help. Yes, I want that. Their voice is going to start becoming confident and saying, on a spiritual level, you're respecting me. My spirit wants that. I'm hearing you. And it's going to be at this equal level instead of this suppressive, I'm superior, you're not mode. And so that spiritual aspect, to talk to someone, to be with someone, to sit with someone, tell me what you want. Tell me what I can do for you. How can I support you? Versus I'm telling you, right? Those are framed differently, and we're going to receive different answers and energies when we come from this respectful, what do you want? This other perspective, and how can we guide that process for our patients, for our clients, for those we work with.
Thank you so much, Dr. Fox. You bring up another great point of it's going to be awkward. Like there is no getting around it. And I think as healthcare providers, we want to make sure we're doing it correctly, and it's not perfect, but it's refined at least. But the problem is it's never been done before. No, there is no guidance, but to do it and to do it openly,
Yeah.
is respectful in itself.
Yes.
Thanks. Awesome.
All too often professionals come to the meeting place, the office room, thinking I know more. So right there, that's oppressive. On a spiritual level, our spirits aren't going to be open. When you come to the office thinking, okay, what are we going to learn from each other today? How can I help you? You tell me how I can best support you with what I know, and then you tell me what I don't know and how else I can support you. That's true healing. That's truly coming together. That's building a relationship with the healthcare nurse, with the physician, and vice versa, right? You're going to learn about the client, the patient, where they're from. You might be introduced to elders, to spiritual leaders, and then you're growing your relationship, and on a spiritual level, my gosh, great things can happen.
Absolutely. Another great point, right? Beyond the physical and into that spiritual level.
Yes.
Lots to consider. And our next question, and I've also asked myself this question, what is the best place to start? Because it's not likely that all the calls to action will be addressed simultaneously. In your opinion, Dr. Fox, is there one that we should start with?
Learning that history and reframing how you ask questions, how you move forward. All too often, people are coming from a place of what I already know. Just come to a place where I don't know, but I want to learn. I want to be open to learning. And when we can come from that place and that space openly and respectfully, then you're going to see manifestation in all that you do. So the different roles you have, whether it's a parent role, a teacher role, medical role, social worker role, politician role. These are all roles we play. It's not who we are. These are all roles we have in the categorization in the systems we operate in. That's not who we are. Who we are is I am Abby Kwikamadaki. That's spiritually, that's who I am. But the roles we think that's who I am, and no, we're not. That's why we get stressed and tied down, and we're disconnected from our spirit and our hearts. We're playing and feeding into the system of economic progression, and we have categories that divide people into poverty and the upper ups and the wealthy. These are all man-made categories, and that's not who we are. If Karl Marx, if Gabor Mate, if some of the other thinkers, if they come back and say, as humans, we are wired for empathy, we are wired for compassion, we're wired for connection, and we are wired for love. Now, nothing else would matter. Inherently, that's who we are as a human being. So if we are ready to create change, I cannot say which one or two or where. I'm just saying, learn, know yourself. Who am I? Where am I going? Where have I come from? And what is my responsibility? These are some of basic questions that you look at any motivational leader, speaker, they kind of ask these questions. And from an Indigenous perspective, you're going to have different answers. Inherently, I am spirit. I'm connected to everything around me.
We are.
And that's my answer.
Thank you so much, Dr. Fox. One more quick question. Some resources, for example, Indigenous patient navigators, exist in acute care. And how do we advocate for more of these resources in urban outpatient settings, like an arthritis clinic?
Yes. I think that's going to change now. There's some really good research being conducted. Again, I, along with Dr. Cheryl Barnaby and another colleague, we're starting to really engage with clients, patients. What do you want? What are you saying? What can we further develop to share with different communities? And so just asking, reaching out. If they don't know, hopefully they're going to say, I'll find out for you. I know so-and-so who's going to provide that information. And so slowly that methodology, that method of moving patients towards good health care is going to be open. And then Indigenous elders, knowledge keepers will be a little more trusting of Western systems, so that at the forefront, our basis is good health, is helping. We're all helpers. We just don't know that. We're all helpers. We want to see good health. Yes.
Amazing. And with that, Dr. Fox, I will be mindful of your time and everyone else's time. And again, say a huge round of thank yous, and remind everyone that this is not the end. This is the beginning, and that your feedback is incredibly important to us. So please complete the quick 3-question survey that will appear when you close this window. We'll also send a follow-up email with a list of resources, reading materials, and thought-provoking questions to help guide your next steps forward. A link of this recording will be shared via email. Please forward it to anyone in your network who you think could benefit from it. And if you didn't get a chance back in April, please join us on June 2nd for the 30-minute webinar, Indian Residential Schools, Perspectives of Blackfoot Confederacy People. This webinar is open to everyone in the arthritis community, as well as the general public. And with that, the team at ACE would like to thank Dr. Terri-Lynn Fox once again for your teachings, and everyone on the call today for your time. We look forward to walking with you on the path towards truth and reconciliation. Thank you for attending and have a wonderful rest of your day.